Hi, I'm here today with Dr. Ellina Seckel. She's a primary care manager and clinical pharmacy specialist at the Madison VA Hospital and Clinics. Thank you so much for joining me today.
Thanks so much. Glad to be here.
Thanks. So as you know, this is a part of a series to talk about clinical pharmacy career paths. So we'll just start out, if you could introduce yourself and kind of describe your educational path and your training up until this point.
Sure. So as you mentioned, my name is Dr. Ellina Seckel. I'm a clinical pharmacist at the Madison VA, but I'm also the primary care manager. So I oversee the pharmacists that are in our primary care clinics, and I also see patients myself. So as far as my education and training, I started in a community pharmacy when I was 15, just cashiering. And that's where I started learning about different medications and finding out how much I love direct patient care and having the opportunity to help patients. So I cashiered until I graduated high school and got my technician certification after that. I did a couple years of undergrad and then got into pharmacy school, and then I became a pharmacy intern. After I graduated from pharmacy school, I went on to do a PGY1 residency focused in ambulatory care here at the Madison VA, and then moved on to a PGY2 also at the Madison VA focused in administration and leadership with a focus in ambulatory care for the clinical part of it.
Very nice. So could you describe a bit about your current position and what you do there?
Sure. So as I mentioned, there's two main parts to my position, first of which is primary care management. So our primary care clinics, there's one main clinic at the West Clinic, a couple miles off the main campus from the Madison VA. And then there are several what are called community-based outpatient clinics, and those are in different outlying areas of Wisconsin and Illinois. There's 5 of those. And there are pharmacists, either part-time or full-time, at each of those clinics, as well as 4 full-time pharmacists at the main primary care clinic here in town. So I oversee all of those pharmacists, help advance primary care pharmacy services, and ensure that all of our pharmacists are providing consistent primary care services to the patients and to the teams at all of those clinics. In addition to that, I see patients myself. So our clinic setup is that we have a team of interdisciplinary professionals caring for patients. On my team, I have a primary care provider, a nurse, a licensed practical nurse, and we also have a support assistant to help with our scheduling, and then myself. And I actually belong to 3 different teams. So one pharmacist belongs to 3 primary care teams, and those primary care providers send me any patients that have chronic disease states that have been diagnosed. So for example, if a patient's A1C comes back at 9, the primary care provider will then send them to me in my clinic, and I will see that patient first face-to-face, and then we'll follow up via the phone, bring them back into clinic as needed for their management of their disease state. We have full prescriptive authority, and we have a scope of practice, which is different than a collaborative practice agreement, meaning my name goes on all the patient's prescriptions that I prescribe for, and no one else has to look at it. There's no protocols. I abide by guideline recommendations when prescribing for patients. That is advanced, I think, in the role of ambulatory care pharmacist, but I think it's where all ambulatory care pharmacy practice should be. Other parts of my role, we have intervened and started working on population management. So instead of just getting referred patients and managing those as they come, looking at populations of patients. So all of my primary care provider panel 1 patients, how many of those have A1Cs greater than 9? How many of those have blood pressures greater than guideline recommendations? And starting to chip off that list, call those patients, bring them in to start managing them as well. So we're looking both at individual patients and then also populations of patients. As far as disease states that we manage, I mentioned diabetes. We also do hypertension, dyslipidemia, gout, thyroid disease, osteoporosis, anemia management. Essentially anything that's been diagnosed with a medication involved, we manage. So that's the long story.
Wow, that's impressive. Sounds like you're working at the top of your scope of practice and really advancing and progressing pharmacy practice. So that's really great to hear.
Yeah, definitely, and something that I would encourage every student to look into as a possible career path. It's not something that I was fully aware of as a student, and I'm glad that I had the chance to go on and do residency to expand what I thought pharmacists could do.
Definitely. So could you expand a bit about what's the most rewarding for you in your current role?
Absolutely. So I'd say, again, there's two main parts to my job. From the patient care perspective, definitely the most rewarding is when patients feel they're cared for. They tell you that. So to have the chance to sit down with people and listen to them and find out what's important to them. They may have very high blood pressure and maybe have been told you have to take these medications, but there's another reason why they're not. Maybe they saw their dad die from falling because their blood pressure was too low. So you start to have the ability to create relationships with patients and dig into truly what their motivations are and find out about them as people, and they can feel when you really care. And that, I think, has been the most rewarding, hearing feedback from patients that, wow, thank you for listening to me, thank you for caring for me. I know that you have my best interest in mind. As far as the management part, the most rewarding to me, I think, is seeing the people that I supervise succeed. So giving them opportunities to take on leadership positions and grow in their role and seeing them happy, that's also incredibly rewarding.
Oh, you're in such an integrative role. You get to work with so many different people, so that's great.
Yes, definitely.
Awesome. Could you expand a bit about what's the most challenging in your current position, especially with working with so many different people?
I think you hit it right on the head. That's definitely the most challenging part, is balancing all of the different roles, both from a supervisory standpoint, from a patient care standpoint. Taking care of people is not easy. I think it's what we're trained to do, but it's definitely not an easy thing. And so you have to remember that these are real people you're taking care of with real needs, and they need prompt attention. I don't know if you've ever been in a position where you're waiting for a lab result to come back from your physician's office, or you're waiting to get a procedure done, and it's frustrating and it's frightening sometimes. And so keeping that in the forefront and remembering that even though I have all these responsibilities over here, the first thing that needs to be taken care of are the patients. But the balance, I would say, is the most challenging aspect.
Definitely. And it is very challenging considering all the psychosocial aspects and treating patients. You really want to treat them as a whole person and consider all aspects of their lives and their care.
Definitely. You could spend 24 hours a day, 7 days a week caring for patients. It's very easy to do. So there's a lot that goes into it. You're exactly right.
Definitely. So outside of your clinical duties and everything you do at your practice site, what kind of ways do you pursue career development opportunities and leadership opportunities outside of your role?
That's a great question, and something that actually is one of my most favorite parts about being in the pharmacy profession. So I am heavily involved in the Pharmacy Society of Wisconsin as well as the ASHP, and I take on whatever I can from a volunteer perspective. That's probably the best advice I have as far as getting involved and getting your name out there, is raise your hand for everything. As far as PSW goes, for those of you that have never been outside of Wisconsin, you have a gem here. I grew up in Nebraska, and our organization was a great one, not saying anything bad about it, but it is nothing compared to what PSW is. I remember the first time I came in to a PSW meeting, I thought I was at ASHP because there were so many people, and it was really remarkable, the leadership that is developed in the state of Wisconsin as far as pharmacy leaders, the vision that the state has, and the organization itself, how much it contributes to advancement of pharmacy practice. So for me, volunteering for and getting involved, speaking at PSW meetings, at ASHP as well, I'm on a section advisory group for ASHP where you can help I'm on the ambulatory care section, so they have different projects that come down, requests that they need volunteers for, and so I always volunteer to help create either patient pamphlets or videos, things to continue to advance pharmacists and get the word out there. So I would say through organizational involvement is how I continue to push professionally as well.
Excellent. So outside of your leadership roles and professional development roles, how do you commit to outreach within the community in terms of volunteering or student development, any sort of outreach that you do?
Absolutely. So this is very important because you have to maintain both professional advancement but also personal development. And if you put all your eggs in one professional basket, you may get tired and burned out. And so I take the opportunity to volunteer at different non-pharmacy related community events, like at races, handing out water. I used to run quite a bit, not anymore, so now I just admire. But and volunteering at food kitchens, especially over the holidays. You can do that very easily, even just for a day over the holiday time. I've also volunteered at the VA for our residents that have a longer term stay. So we ran a pharmacy-led bingo tournament, which was pretty fun.
Nice.
The residents really had a good time, and that was actually really rewarding because the nurse came out and told us that it was the first time that all the residents were out of their rooms all together. Usually they stay in all their rooms separately, so it was neat to be able to bring them together. So my advice again would be to get involved as much as you can with non-pharmacy volunteer work as well, just to keep things stimulated and fresh.
Definitely, that's good advice. I feel like as students we're always bombarded with pharmacy and we might get a bit too one-dimensional in our vision, so it's good to remember the whole scope of helping patients and helping the community as a whole.
Definitely, and I think it also helps you keep a fresh perspective, because we tend to approach ideas in pharmacy through a healthcare or pharmacy scope, but some of the most innovative and creative ideas come from other industries such as engineering or law, things that you wouldn't necessarily associate with healthcare. So just by keeping some non-pharmacy involvement in your brain, it helps to keep yourself creative too.
Definitely, definitely. So could you speak a bit about what has defined your role as a leader in pharmacy?
That's a great question. For me, I think I'm still looking for what my defined role is. What has been historically, so I mentioned I worked in a community pharmacy as a cashier and then a technician and a student. And as a student, I started a couple of clinical programs there, chronic disease state management focused, one of which I involved a dietitian in our store. So we would have appointments with patients, half dietitian, half pharmacist, and we would look at their medications and they would focus on their diet, and patients actually paid cash for that. So I think the point is, from where I've come from a leadership standpoint and where I want to continue to go, is just pushing the envelope and not working within the confines of what practice is now. I think we have to continue to think outside of the box. People tend to say, well, we don't have provider status, we can't get paid because insurance companies won't pay for our services. Well, you forget patients are willing to pay for valuable services if they see the value in them. So there's cash paying programs you can create. There's MTM Outcomes and Marixa. There are platforms for medication therapy management. So just always, I guess I want to create and hope that my leadership vision or persona would be pushing the envelope and asking for forgiveness, not permission, within reason, of course. But continue until someone tells you no, and then push a little more.
That's a really good point. I think if we just stick with the status quo and stay, content with that, then we're not going to progress forward. So it's really important to keep challenging ourselves and pushing that profession forward as much as we can.
And get out of, the stereotypes of what pharmacy used to be, and get into the new mindset that you're a doctor, you take care of patients, you have the ability to prescribe, and if you don't, create a collaborative practice agreement so that you can, and just get it done, You get over the obstacles if you have enough persistence.
Definitely. So as you're providing a bit of mentorship to me, I'd like to ask you, what role has mentorship played in your life and your career development as a pharmacist?
A huge role. I think it's incredibly important to find one solid mentor, someone you can always go to for anything, but then also start to branch out and expand your network and get the advice and the insight of others. So a perfect example, my boss right now was my residency program director last year, so he's very much a large mentor to me. He's the one who exposed me to the opportunities within ASHP and pushed me to get involved with the section advisory group. And so he's someone that I can always go to for advice and asking how else can I get involved, what else can I do. But I also, just at this mid-year meeting, was asking different women leaders. There was a networking section on women leadership and asking them, how did you get to where you are? What advice do you have for me? Because you can learn so much from people that have been through the experiences. So I would say find one main mentor and then learn from everybody that you can.
Oh, that's great advice. I've never heard that, because people always say, seek out mentors, but it's tough because everyone has different time commitments. So really honing in on one person, that's really great advice. So what other advice do you have for pharmacy students and current residents that they can expand their knowledge and their skills in pharmacy?
I would say to, as I mentioned before, continually push the envelope and take every opportunity to explain what pharmacists do. So, for example, every time I fly on an airplane, the person next to me is subjected to finding out about what pharmacists do. And use language that people understand. So much in the pharmacy profession, we get bogged down by these different terms and we don't use them the same, and they mean something different to every person. So tell them, you know, in my practice setting, I prescribe for patients. They understand what prescribing means. I'm a doctor of pharmacy. Make it known. You want people to understand that pharmacists are doctors too. And break the culture, break the mold. People are used to thinking of pharmacists as behind the counter, counting pills. And make sure, I've even said that before, I don't count pills. I take care of patients. I prescribe for them. I touch their feet. I listen to their heart. And yeah, every opportunity that you have to influence one person, they're going to talk about it with someone else, and that's how you change culture.
Definitely. Just starting to separate ourselves from the product of the medicine and really getting into that consulting role and patient care role is really important. I agree.
Yep, you are a healthcare provider.
Definitely. Well, thank you so much again for taking the time to sit down with me and offer your valuable advice and everything you've gone through to get to this point. I really appreciate it.
Yeah, happy to be here. Thanks for having me.
Thank you.